I'll give a simple clinical case where a 45 years female was brought by her relatives with complaint of unresponsiveness since morning, that is since last 6 hours. So she was brought into the casualty and we have examined her. She was almost comatose, not responding to any kind of painful stimuli, but instead her vitals were stable with the pulse was in between 60 to 70. She was having a moderate hypertension, that is 90 by 60. She was breathing, respiratory was good, but she was not at all responding to any kind of stimuli. Then what the first scenario there has been done, they have secured the airway, they have seen everything, the circulation is good. On examination, she was found to have a pinpoint pupils. When she was asked about the history of her past illness, she was found to have suffering with a major depressive disorder, and she was on regular medication which were not aware by any other person except by herself. So it was a case of intoxication where we have to find out the exact medicine which or culprit which is causing this intoxication symptoms. So general principles was followed and they have suspected a drug and they are given a drug called flumazanil 0.3 mg. It is a test dose whether to just diagnose whether she has consumed the drug or not, and after in administration of 0.3 mg of flumazanil, patient gained conscious levels and she was responding to even the commands. Then the question arises, what is the drug which she has consumed and patient was exhibiting the signs of intoxication? And the drug is called as benzodiazepines because they have been given a specific antidote which is called as flumazanil. Flumazanil is a specific antidote to the benzodiazepines. In common language, what are the benzodiazepines? Mostly they are used as anticonvulsants in emergency situations, and in chronic medication they are mostly used for inducing sleeping pills. Probably the patient has consumed overdose of sleeping pills or benzodiazepines. Yeah, so we have come to a conclusion that the patient might have been consumed benzodiazepines or sleeping pills because she has responded to the antidote flumazine. Now coming to the point, what are benzodiazepines? How many types of benzodiazepines we have? How they work? What are the side effects? And how you treat a patient in acute setting when the patient presents to you signs of intoxication of benzodiazepine. Benzodiazepines have been used since 1952. Earlier, barbiturates were the favorite drug for induction or sleep for any sleep disorders. But due to a lot of side effects attributed to the barbiturates, benzodiazepines has gained importance. And the first drug among the benzodiazepines, chlordiazepoxide, which is most commonly trade name is Librium, which is most commonly used these days. Now coming to the classification, there are two types of benzodiazepines which depends upon the duration of the actions. They are long acting and short acting. Long acting, basically they are having more duration more than 2 hours, and we say short acting when the duration is less than 2 hours.